Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hello, everyone. This is Dr. Sandy Newis, co-founder and president of the Living Medicine Institute, where we provide content, resources, and training for clinical and medical professionals who are interested in deepening their practice or launching into the field of psychedelic-assisted psychotherapy. And I am excited to have Dr. Raymond Turpin. He is a clinical psychologist and the founder of the Pearl Institute in Western North Carolina. So we share this. I am in Asheville and he is in Waynesville, which for those of you who don't know is like 35-ish minutes apart. Dr. Turpin holds degrees in psychology from the University of Georgia and University of West Georgia and earned his doctorate from the California Institute of Integral Studies in San Francisco. He has worked in a number of settings, including psychiatric hospitals or emergency units, residential treatment centers, schools, and other types of clinics. He co-founded Jackson County Psychological Services, working in low-cost mental health care across multiple school districts. However, what I most know him for is that he's been a longtime researcher and looking at therapeutic applications for ketamine, and he provides ketamine-assisted psychotherapy and integration service at the Pearl Institute, where he supports trauma-informed care for veterans, musicians, I love that, and individuals with treatment-resistant conditions. He serves as a mentor in the Certificate in Psychedelic Therapy and Research Program at CIS and has a private practice in Waynesville, North Carolina, and he is also an MDMA researcher. So one of the founders and architects of one of the expanded access sites that kind of hung in there to the end with MAPS. So that's another place that I know you as well. So thank you so much, Dr.
Thanks for having me.
Yeah, is it okay if I call you Ray here while we're here? Great.
Absolutely. Yeah.
Good. So I always like to kind of say a little bit about how I know people. So I actually met you. You may or may not remember this, but it was at an event shortly after with Michael and Annie Mithofer and some other people in the MDMA world. This was a number of years
remember that
now at One World West. And I remember I kind of talk it like conference stalking. So this was a mini version of that. I was like following you around. And I found you at the bar. I was like, oh, sweet. And
that's where you can find me usually. Yeah.
That's where we were ordering a drink together. And I was like, all excited, like, how do I get into the MDMA field? And you literally go, well, it's hard. And I was like, okay, tell me. And you go, well, you kind of have to be willing to like sweep the floors. And I was like, what? And you're like, I have been knocking on this door for a long time. And I basically said, I will do anything that it takes to get into it, including sweeping the floors. And I'm like, I'm willing to sweep the floors.
Yep. That's what I told Michael Mithofer back in 2017 when he was saying he was going to maybe try to get an expanded access site for Asheville. I said, I will sweep the floors. I'll do whatever I need to do to just be able to help out. So yeah, that is a true story.
Yeah, I remember it well. So, what is your pathway into this field? I am aware of the fact that you've been in it for a long time, and not just in it, but committed to it. So, tell me about that. What is your pathway, and why is this important to you?
Well, I think you have to go back to college, which is where a lot of us kind of discovered psychedelics once we got out of the house and had some freedom. So I was at the University of Georgia in the mid 80s to the late 80s. And probably my freshman year of college, I found Timothy Leary published his book Flashbacks. And I ended up somehow getting a copy of that and I read it. And I was struck how, despite the controversial nature of his actions and things that he did, it's he was a brilliant person, and so I read that and I think his brilliance really came through, and he was speaking very eloquently about psychedelics, particularly when he was talking about his first mushroom experiences. And so I got very curious about mushrooms in particular, and so about I think October of '84, which was my sophomore year, me and two buddies ended up scoring a quarter of mushrooms, and so the three of us split them. And I had a pretty profound experience where I was on a track at the time to be an advertising a creative in advertising, and at the time I kind of figured I had I was fairly creative, and I thought, well, I'll use this and I'll make a ton of money. And that was kind of my thinking back then. And then I had this experience that really just sort of showed me the future of that path. And then just was struck with this kind of existential emptiness, for lack of a better term, about the fact that it wasn't going to really provide a whole lot long term, other than, I mean, I saw myself achieving all the goals I thought I needed and wanted, and then realizing that's really not what I wanted. And so that kind of got me on the path that night, because it got me thinking, what is it about these mushrooms that I took that, imparted all of this awareness to me? This knowledge wasn't in the fungi. This was basically helping me access, what felt like a truer part of me that had sort of been socialized out, by that point. And so that's kind of where it all started, was just being struck by the power of these things to be able to, create such a profound change of consciousness. And then that drove me into the UGA library, looking up everything I could on psychedelics. And I found this enormous trove of research that had been done in the 50s and 60s, particularly with LSD. And then the other thing I was struck by was the results that they were getting from these experiments, where there were these, retractable conditions that had not responded to psychotherapy, and they would try LSD because they were just kind of scattershot. Because when Sandoz discovered LSD, they put it out to researchers and said, hey, we've discovered this really powerful chemical, but we don't really know what to do with it. So if you'll send us a request on letterhead, we'll send you a supply of LSD, and all we want is for you to share with us what you find out. And so,
Can we just pause for a minute? Like, I
yeah,
don't know that everybody knows that piece of psychedelic history, just how,
right.
like, back in the day when this first emerged, like, just how easy it was to get and how much active curiosity there was amongst the, psychological scientific community. Like, that
Yes.
piece, like, you just send them a thing on letterhead. Like, I mean, I can corroborate that. I have heard that from multiple elders in the field. Like, that is factually true.
Yep, you would send a request in on letterhead, and then they would send you these little ampules of what they called delicid at the time. And they were like, we don't really know what this is, but please feel free to experiment and let us know what you
Right.
find out. And so that's kind of how it all got launched. But I was looking at all these research studies, and there were really some, it was incredible, some of the results that they were getting. And, of course, then there was the whole cultural backlash, which we've seen recently in a very smaller scale with the MDMA situation. But there was all this cultural backlash against LSD because it was starting to threaten the power structures and some of the things that were going on in the country at the time. And so there was a huge backlash where it all got shut down. And it took years to come back to this. And that was interesting because I was stumbling into it in 1984, and that was the just say no era, Nancy Reagan.
Mhm.
Drugs were not cool, with the majority of Americans. And so, yeah, it was just kind of a path that sent me on this discovery of the fact that, wow, these things really have some interesting potential. And then I became curious, why are we not talking about these? Why did it just go away? I remember going to some of the UGA professors, and they were like, don't waste your time with this. It's been done. There's no career path forward, da 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 da. But I kept thinking, what about all these results? And admittedly, the studies back then were not great as far as how they were structured. But that is also addressing some of the difficulty of studying psychedelics with the current scientific model. Um, and things like blinding, which you couldn't do because it was, you knew generally within an hour who got the psychedelic and who didn't. So there was all these problems back then that they used as excuses to shut down all the research and say it wasn't legitimate. But yeah, there was just something back there that I was thinking this is definitely worth pursuing. And so that's kind of where I made my decision back then. Was I was like, wow, I'm gonna just kind of follow this path because it feels like there's something there. And even though I didn't ever know if I could ever legally use them in my lifetime, I thought this is worth studying. And so I just tried to read everything I could, and did a little work with myself, did some self-experimentation research, and gradually just developed this understanding of it. And then thankfully I'm still upright and working, and the door cracked back open on it, and so yeah, we were lucky enough to be able to get in on some of the MDMA work a couple of years ago. But so yeah, that's kind of my story and how I got onto this path.
So I want to move into that MDMA work and the development of the pearl, but I also, one of the things I believe I know to be true for you is that don't you, how isn't part of your journey the Grateful Dead?
Oh.
Like
Absolutely.
we share that. And so, the
Yes.
reason why I bring that up is because so many people are like, I don't know about that in the party. I'm like, I don't think it was just a party. I
Oh,
don't
it
think it
wasn't.
is just a party. So I'm just kind of curious, if could just speak briefly about, that particular influence, because,
Hmm.
you know,
Oh,
I'm
I can
part
prattle
of
on
it.
about that one.
Right.
Yeah, no, it definitely, it was a party, but there was definitely a lot more going on. And,
Yeah.
one of the things I think the threads of the Grateful Dead go all the way back to the Lucinian mysteries, where people would get
Mm.
together in this sort of ritualized environment and take probably what sounded like a powerful psychedelic and have these life-changing experiences. And that's essentially
Mhm.
what was happening at the Grateful Dead. I mean, you would
Yeah.
go and you'd be in a room with, 15,000 other people, probably 90% of them high on something, usually LSD. And back in the day, the band would be too. And that music came out of, this amalgamation of different musical styles. They all came together and they were all, working with, taking a lot of LSD back then. Their benefactor was Owsley Stanley, who was one of the most prolific LSD chemists of the 60s. And so they generally invented this style of music that came out of the LSD state. And so
Mhm.
people would come together at their shows and kind of alter their consciousness in a similar way. And you were there. Some pretty
Yeah.
interesting things happened that went way beyond just hanging out listening to music. I think it was my psychotherapy for about 10 years, and I always felt like the Grateful Dead was psychotherapy on a grand scale, that people were coming there and accessing parts of themselves and this music that was so well suited to that state of mind. And then, the lyrics typically were very mythical, archetypal. So a song could mean something for several years, and then one night you're at a show and something's going on in your life, and then a whole another meaning of that song opens up. And so, which is what great art is, when you've got, all those levels of meaning. So yeah, there was way more going on with the Grateful Dead. And like I said, it became a lifestyle for a certain segment of the population, a little bit of that moth to the flame syndrome. But yeah, it was wonderful. I sure enjoyed my 10 years of seeing shows. Yeah.
As did I. And we could go on about this too, but just to kind of, to me, I love Brené Brown's term, collective ecstatic experience, and it just kind of, there's so much emphasis on this clinical model, which of course I want to get back to and talk about because that's really why we're here. But also there is potency in the group and fitting into the current. Like one of my teachers talked about grounding yourself in the current. And,
Hmm.
to me, that applies. So I'm just kind of just putting that out there just for all of us to just ponder.
Yeah.
So
Yeah. It was a great classroom for me. I learned a lot
totally.
about the mind, and just, yeah, it was a wonderful
Mhm.
10 years. I miss it terribly.
Yeah.
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 All right. So you went from this interest to kind of into MDMA land. And I know out of that came the Pearl. So maybe you can kind of segue us into those. Like, how did MDMA emerge into this? How did that really capture your attention? Tell us about the Pearl. How did that come to be?
Hmm. Well, I was really familiar with MDMA because by the time I got to Georgia in the 80s, it was everywhere. I tell this story.
But
There
it
was a
was
bar.
legal then too, right?
Well, it was not illegal. Let's just
Ah,
say
got it.
it was not illegal. But I tell the story. There was a bar on Baxter Street in Athens where you could go and you could slide the bartender $20 and he'd slide you a hit of MDMA. And so
Mhm.
there were these wonderful parties happening up there every night for a while, until the owners got really pissed. And it wasn't about the MDMA, it was the fact that nobody was buying alcohol. And so everybody just wanted to drink water. And so they weren't making any money. So they shut that down eventually. But so, I was very familiar with, let's say the recreational uses of it because it was everywhere back then. And then so was kind of keenly watching the research, the phase one, and two and three, which was starting in the 2000s. And so I got an email from CIS, which was where I got my doctorate, that they were starting this certificate program in psychedelic therapy and research. And so I wasn't able to go the first year. It was just too much money, and the logistics of getting to San Francisco 7 times was just, I couldn't do it. So I did get in the next year, 2017. So I was in the second cohort, and and MDMA was, being researched heavily at the time. So that was definitely a part of the program. And, the Midhoffers were attached to the program. And through a lot of strange occurrences, Michael ended up being my mentor for the
Nice.
program. And we had to have what was called a capstone project at the end. And he said, why don't you write me a description of what you would do if you had an EA site, an expanded access site in Nashville? What would that look like? And so I wrote my paper on what basically became kind of the bones of the Pearl, this idea of a nonprofit that was, going to be able to, hopefully treat people, but also train therapists and just be this hub for getting this MDMA assisted therapy out into the world. And so that's how I established, that's how I got started my relationship with Michael and Annie, and that they're wonderful people. They've moved up here to the mountains, so they've been in Asheville now for a few years, and so. Yeah, and then just the whole thing became insane at that point. I think then MAPS put out a call for sites that were interested in possibly being an expanded access site. I think there was about 200 plus sites that applied, and they picked 10, and we were lucky enough to be one of the 10.
Mm.
And then as things moved ahead, I've been waiting my whole life to do this. So we were on top of things. We had our paperwork ready. Something needed to get done. We'd go do it. And so we were the first site to get inspected and activated. And then somewhere along the lines, and I have no idea why this happened, they decided they wanted all the research done up at this facility up in Maryland, and they wanted them to have all 50 of the expanded access treatment cases. But the only problem was we'd already gotten in the gate, so they had this kind of turd in the punch bowl called the Pearl that had gotten in, and they didn't quite know what to do with it. But so they let us treat one person. And this was a gentleman that was 54 years old. He'd had PTSD for 35 years, going back to his military service. And, he had it for 35 years. And after the 3 MDMA sessions, he no longer had PTSD. And so they were going to, there was a lot that happened I don't have time to go into, but we were about to get shut down. And I went to MAPS, and I essentially said, I've got 3 people that have been on this wait list for over a year. Can we at least treat those 3? And one of the MAPS people we were working with was really kind, hooked me up with the folks up at Sunstone, which was the facility doing most of the research. And I explained the situation, and he said, okay, you can have your 3. I said, look, you can have 46. Can we just treat 4? So. And then they said, you got to go back, and if you got to get your people in because we're getting close to the 50. And he said, if you got 49, 50, 51 ain't getting in. So we came back to Waynesville, cracked the whip on all 3 of these poor people and got them into cardiology tests and everything. But we managed to get all 3 to qualify. And so that is the story of how we got to treat 4 people. And that's kind of how the Pearl came about. Like I said, it was originally designed to be like this MDMA assisted therapy hub for treatment and training. That was the whole idea of it. And I wanted it to be a nonprofit model so that we could have better access. And I figured it'd be a great place if we were training people. Because right now we've got over 2,000 people out there that have had the MAPS training, but they all lack the supervised clinical portion, which is treating somebody and being supervised throughout. So there's going to be an enormous bottleneck potentially of therapists that need this piece. So the idea was to be able to have the Pearl, help get that taken care of. Because there's a lot of folks in North Carolina here, even just as yourself, that went through the MAPS training and this lacks that part. So that was the idea. That was the idea behind it.
Mm-hmm. So I want to also humanize that and just be like, oh my. Right? Because, I know that you are very mission driven. That's a word I like. I have been very mission driven since the early 90s in this as well.
Mm-hmm.
And, you and I have been paralleling each other for a long time here.
Mm-hmm.
And I know it's been really hard. Like, it's just like, that's a lot. You were like, oh yeah. And then we rushed everybody in and we did that and we got all our paperwork in order. And I just went up and talked to the people in Maryland and, just kind of you make that sound so just and I just first want to just acknowledge for those who might find that of interest, this is a huge amount of effort and all those levels of pulling all of those pieces together and making that happen require a great deal of drive. So first, thank you, because those are really meaningful contributions and you're doing it. So you're doing what you have committed to do. And second, just kind of acknowledging that, what is it? Maybe you've already mentioned it, but there's something about this that is pulling you to continue to push this rock up this hill? Like, so what are you seeing? What are you witnessing? Tell us about that.
Well, I've been in this mental health racket since I was about 21. And so
Hmm.
that is going on 40 years. I just
Yeah.
turned 60. And one of the things I figured out, which we've all figured out by now, but one of the things personally I thought for myself about 15 years ago was it's all trauma. You take,
Mhm.
regardless of diagnosis, you go back to the beginnings of the problems, and it's always poorly integrated trauma. And we just don't, we have some really great top-down psychology or psychotherapy techniques, verbal techniques for getting at things, but it's really hard to get at those primal wounding, and that all these symptoms are stacked on top of, because these symptoms are nothing more than compensations for the trauma. And
Mhm.
so I have been for many years thinking if we could ever find something that was really effective at healing those primal wounds of trauma, then we're going to see our top-down techniques be much more effective. And I always knew from going back to my research at the UGA library, I always knew that we had compounds that could do that,
Mhm.
LSD,
Mhm.
psilocybin, now we're seeing that ayahuasca, DMT, we've got these compounds that are able to really access, what's down there deep. And so that's been the drive, is that if my whole life has been spent trying to help people, and, anybody that's in this racket knows that it's about trauma. If you're working in mental health, it's about dealing with trauma and the after effects of trauma,
Mhm.
that it's this just deep belief that we have what we need to fix people. I do believe that. And I think that it's a crime that we have not been able to have safe legal access to these medicines for the last 50 years. Because think about how much we would know by now about how to use these things and to use them as effectively and safely as possible. But we've been denied the ability to do that. So, but I know that we have what we need. I am convinced that MDMA has the potential to cure PTSD, and I feel like it is borderline criminal that continue after 30 years of FDA supervised research, that we are continuing to not be allowed to have safe access to these compounds to be able to help people.
Right.
Yeah, so that's kind of why I've been on it, is that I recognize that we have what we need, and it pisses me off that we can't access what we need and help people with what they need. And so that's kind of why I've been on this. And
Yeah.
yeah, and you're right, this thing has been the hardest thing I've ever done in my life. But it feels like the path that I picked. And so it's just been like, just keep pushing the rock up the hill. That's kind of what it
Totally.
feels like. Yeah.
Right. I want to just name a piece about the research for those who are listening. You just named two really critical pieces, which is one, people don't realize that the FDA was actually involved from the very beginning with the MDMA research all the
Mhm.
way up to the end. And that the methodological criticisms, the majority of them are inherent in psychotherapy outcome research. So, functional blinding, people knowing, which means people knew when they got the placebo, expectancy effects, like people knowing that they're going into a study that they can assume would help. Things like that are just well published and inherent all over the psychotherapy outcome research. So, that's just an important piece for people to understand, is that the FDA was involved from the beginning, and those types of methodological criticism were actually taken into account because the study itself followed psychotherapy outcome research methodology kind of
Mhm.
structures as well. So just kind of naming that. And then the huge disappointment about in August of 2024, when there really was, because of 30 years of research, there really was an expectation that this was going to be approved for therapeutic use. So just
Mhm.
naming that. And then the other piece about that's important for people just to consider, and you also named it, is while there may be risk in approving such a compound, 30 years of research really shows where the risks lie and
Mhm.
suggests how to mitigate them. But there is also huge risk in withholding effective treatment. And so let's
Right.
just, name that. So I hear that energy around that. Are you kidding me? You said, like, it really pissed me off. Like, let's just speak plainly. Like, yes.
Yeah, especially when you see people suffering. And
Yeah.
one of the things I learned from the MDMA research we did with our four patients was that, you know, when you think about carrying PTSD, our four had PTSD from a minimum of 35 years. One guy had it for 62 years. And so one of the things I learned is that you live your life that long with PTSD, and then you go in and you give them a powerful compound like MDMA in the context of therapy, and you find their PTSD goes away. It's like, yay, they don't have PTSD anymore. But one of the things I learned is it is enormously challenging for these people to learn how to live in the world without PTSD. And that doesn't sound, it's like, oh, wow, they get to go out and enjoy their life. And that is true to some extent, but they have decades of behaviors that they've learned that have become ingrained in how they are in the world. And then all of a sudden, they don't need to have all of this. And it's an enormous, so one of the things that struck me was the level of support and integration that we need to continue to give these people following MDMA treatment, because it does have the power, I think, to do some very deep structural changes and make our psychology, our psychotherapy techniques much more effective. But it's a seismic shift in existence, and it made me realize how much we need to take care of people following these treatments. And I think that was some of the criticism, and that's part of the problem with the scientific method and the way we do research. It's like, oh, the protocol is over. That's it. We're done. We can't have any more.
Therefore, you're
Yeah.
actually literally done.
Yeah, and there were some people in the MAP studies that were like, well, I've got a lot of depression, because that's one of the other things we've seen is that PTSD takes up so much bandwidth for people that when you turn the volume down on the PTSD enough, then all of a sudden they've got the bandwidth to feel their depression more. And so it opens up the door for some different problems. And so we need to be aware of these problems, and we need to be prepared to give people the support that they need. So that was one of the shortcomings of, this particular research method, is that, the protocol ended, that was it. And so that was one thing we learned.
I think I want to just, kind of, because I see, interestingly, and we'll get into ketamine in a minute, but because I want to stick with the MDMA first, because that, is your unique expertise in that. But like, it's interesting because with ketamine, I actually see almost the opposite. Like, it's really effective with depression, and it like lifts the like protective blanket of the depression, which has been tamping down the PTSD symptoms. And so I see the reverse with ketamine, that the depression remits and suddenly people are like really in there, that, they're like, oh, I'm more anxious, when really you dig in, you're looking at, classic PTSD, or maybe some developmental and relational trauma. So it's interesting to hear you say that in reverse with MDMA. I find that kind of fascinating. And then the piece about, one of the things that you also just named something I think is of critical importance in trauma work in general, but especially with psychedelics, is, we also have to help people feel safe, feeling okay. Like one of my colleagues and friends, Katie Asmus, she's in Boulder. She's not in psychedelics, but she's got a couple toes in it. And she has this beautiful phrase of, is it okay to be okay when things are okay? And if you're used to being in a constant state of hypervigilance, like your nervous system is going to contract back into that protective place. And so teaching people how to feel safe, feeling okay, I think is what I heard you say. I mean, I'm just putting different words to it. Would you agree with that? Or do you have something to add to that?
Yeah, I would agree. And that's the primal requirement of doing any trauma work, is that they feel safe. They feel safe enough with you in the therapeutic relationship. They feel safe enough in the environment to where they can actually go in and do the work. And again, when all of our conventional psychology techniques, the problem is we're up against the amygdala half the time when we're getting to do the trauma work. People get triggered. And one of the great things about MDMA is shutting down that amygdala 95%. So it actually allows people, not only does it allow the trauma memories to emerge into consciousness, but it puts people in a position where they can be present and do the work that they need to do with it. So yeah.
Well, so you started with MDMA and then you moved into ketamine work and also training. So let's talk a little bit more about the MDMA work, because I'm really curious about kind of how you see those two things kind of separate but different, but we'll get to that in a minute. So, what did you find the most meaningful? Like, you were deeply committed to this. You pushed this rock forward. Like, what did you find the most meaningful parts of the MDMA work? What did you witness? What did you love about it? Because it's like, let's face it, it's a big deal. You're in with somebody for like 6+ hours, right? Like it's
8
a commitment.
usually.
Like it's so 8 hours, whole day, whole thing. Like, what are the most meaningful parts of this, and what did you witness?
The most meaningfulness was the effectiveness. The fact that these people are actually able to access, healing states and to be able
Yeah.
to get relief from their problems. I think probably the biggest thing was to me the confirmation of this idea that's not all that revolutionary, but this idea that we all carry this inner healing intelligence deep down, that
Mm.
we all, you clear out the ego, the fear, the anxiety, you clear out all that shit and you get right down to, the deep self, capital S. There's a force there that's pushing to be conscious, that really wants psychological wholeness, that wants emotional balance, wants on. So I think we're inherently wired that way, and then life gets in the way and creates problems. And so I think one of the most important things I saw was that I really do believe this concept of, and it goes back to Groff, it even goes back to Jung. Michael Mithofer's MDMA assisted therapy manual is really based on this idea of this inner healing intelligence. Um, and that was something that the advisory committee made fun of,
Mm.
in the AdCom meeting that they had back in June. So, I think it was the effectiveness of MDMA, and then some of we all know what MDMA is doing in the brain. We understand the amygdala
Mm.
is being shut down. We understand that the prefrontal cortex is getting hyperactivated. We understand that trauma information is finally being sort of processed in that higher order thinking way that it should have at the time of the trauma, if you weren't so worried about dying or your brain wasn't in survival mode. And so, I think the most interesting thing I saw was, well, what does that look like? Yeah, we know biologically kind of what's going on in the brain and what the healing mechanism is, but what's the phenomenological experience of going through that? And some of the things that our patients were reporting, just their experiences, it was also a lot of it was highly visual, which you don't think of MDMA as being a visual psychedelic, not like the serotonergic ones, that are more visual. But this one was people were they were reporting clear imagery. They were, and we had, a couple of people really interact with the imagery and whatever was coming up. So there was these incredibly beautiful stories of people in their own unique way healing their trauma. And the part that struck me was none of this was based in the ego. This is not something they cooked up. It's not something I'm going to make up this little story to heal my trauma. There was something welling up from this very deep place of inherent health and wisdom and balance. And it was just incredibly powerful and beautiful to witness. I mean, we had a couple of there were so many incredible stories. And so to be able to witness the power of this and the effectiveness of it. And like you said, we have 30 years of FDA supervised research. We know how to screen people. We know how to treat them. We know how to make it safe. We know how to make it effective. But that was probably the most incredible thing, was just the stories that people would say. They would generally, these sessions would be people going into the eye shades and the headphones, and they'd lay there for maybe an hour, hour and a half, and then they'd pop out and they'd want to talk to us for about an hour, and then they'd be like, I think I'm going to go back in. And it was just this wonderful, in an internal, external process. But the things that came up when they were doing their internal work were just so beyond the ego's ability to construct, that was the part that really amazed me, was the power that we all have to create these healing events within us. And I think Michael Mithofer said a great thing. He said, the real research we ought to be looking at is we really ought to be researching this concept of inner healing intelligence, that that
Mm.
our species potentially has this ability. And we're not researching it at all. I mean, most of us don't even want to accept that that's even a thing. So but that's probably the answer to the question, is just the power and the effectiveness of this medication. And again, it needs to be given in the context of therapy. It's otherwise every raver running around that ever took MDMA would be psychologically whole and balanced, and we know that's not the case. So you got to have therapy in there. So, but we do know how to do this. And like I said, it's borderline criminal that here we are, 22 veterans a day suiciding in the United States, most of it because they can't, acclimate back to life with their PTSD. And we have the ability to help these people and to help these families. And so by not allowing this to have access safe and legally, we're just continuing to allow the intergenerational transmission of trauma. And, we've seen, kind of where our culture is at this point because of that. And yeah, it's just really, really kind of annoying that we're at this place.
Yeah, that's interesting. Okay, so this is a total segue that we could talk about forever, but I
Yeah.
do want to at least mention it and just see if you have any brief thoughts. Um, you also mentioned that psychedelics were your psychotherapy. And you mentioned that you yourself had profound impacts with MDMA. You mentioned a bar and things like that back when it was like semi-legal.
Hmm.
And so you're also saying that we need therapy. So I too have similarities in this, like have so I'm just curious, and you're like, yeah, but every raver would be psychologically whole. Like I get it.
Right.
So yet there is, so one of the things that I've been kind of working out with people is like there's therapy and there's therapeutic.
Hmm.
And therapeutic, you can have a profoundly therapeutic experience in a lot of contexts, psychedelics or not. Non-ordinary states of all sorts can be very therapeutic. But
Absolutely.
therapy is different than that. Like, it's preparation, it's medicine, it's integration, it's the use of psychotherapeutic techniques. So
Hmm.
can you speak to that? Like you've experienced both. Like, so, what are your thoughts about that?
That's a great question. Again, I think therapy, like you said, there's prep, there's in-session support, there's integration, there's a framework that you're operating within.
Mhm.
I think therapeutic experiences, with or without psychedelics, I think those are potentially as healing as anything else. But I think there's definitely more onus on the experiencer to be able to say, okay, what am I going
Mm.
to take from this experience? How am I going to bring this into my life? How am I going to allow this or encourage this to make positive changes in my life? I think that's the biggest difference, is that there's much more on the individual to say, okay, I've had this experience. And our culture doesn't give us a blueprint or a framework for understanding psychedelic experiences. That's why people go to these indigenous cultures, or they may look to Eastern philosophies because they feel like there's more of an explanation for what's going on from there. So we're bereft in Western civilization,
Mhm.
essentially, of really clear blueprints or roadmaps to help people understand, here's what these experiences mean. And so I do think that these therapeutic experiences can be incredibly valuable, but it just puts a lot more on the experiencer to be able to make them count, I think.
Oh, that's great. Because I used to actually go to dead shows early on when I started going. I would go by myself because at the time I didn't have anybody to go with, and I was really feeling this pull. And it was, and I very quickly realized like how anxiety producing that was, and yet how incredibly healing it could be. So I was very intentionally navigating that, like
Mm,
unplugged from like a core group to land with in order to do that work. But
yeah.
I don't know how I knew how to do that. I don't know where that came from. I was getting a master's degree at the time, so maybe it was that or an undergrad in psychology, or maybe I was just that way. But I love what you say about that. Like going in with intention and intentionally holding that as you move through an experience that is the experience of being impactful for you is still not the same as working
Hmm.
with a trained therapist, and all of those different things.
Right,
So,
right, right. And just to piggyback on what you said, I do believe that the music and the lyrics and the stories of the Grateful Dead songs, so many of them, there were keys in how to integrate. I mean, there was it definitely, even though it wasn't put forth as, here's a model for how to live. That's kind of how a lot of us were experiencing. And so I do believe that was one of the reasons why people gravitated to it, was not only that it provided this sort of safe, consistent space that you could go in and have these potentially life-changing experiences, but I think the music and the culture around the music also did give us a framework for understanding what was going on. And we're a part of this thing, and we don't really know what it is because you can't really describe it, but there's something going on that feels important and it feels consequential. And I
right.
think that I think that the music allowed us to kind of have a little bit, and that culture gave us the roadmap and a little bit of the blueprint to sort of know, oh, okay, so you're having this experience too, and so are you. And we're going to go out and be this way in the world because we're going to sort of represent what we're learning in this way. And so I think it did give us a little bit of a framework to operate out of, which allowed us, I think, to make, hopefully make those experiences count.
Totally. I mean, I would say like, show up, find a way to fit into the vibe, like that,
Mhm.
is value added and doesn't detract from, figure out how to find your place, assume belonging, and don't be a jerk. And then let it just like impact you and then go out and continue to carry that into the world, which is really quite similar to a kind of a relational focus to working with, psychedelics in general. So
That's right. That's right. And don't be a jerk being the
don't be
key
a jerk.
phrase. Yeah, we could all use a little more of that these days.
Right.
Yeah.
Let the weirdos fit in. Just open up a space for them. Move over.
That's
Like,
right. That's right. And you'll find they're actually nice, funny people most of the time. So, yeah.
right, right.
Yeah.
Yeah. So, MDMA, you had the opportunity to do it. You're on board to, continue to do it. One of two places, which is amazing. So, and then I also am aware of the fact that you made this kind of opening to ketamine. And some of that may have been driven by business, some of it may have been driven by interest, maybe all of the above. Um, so let's switch to that. Like, your clinic does, maybe just tell a little bit about what the Pearl does in terms of the, clinical use of ketamine. And then what do you love and what do you not love? And,
Hmm.
$1 million question, how does it compare to MDMA? Like, let's just talk about that.
Yeah. Well, at the Pearl, we've been doing ketamine-assisted psychotherapy for several years. Generally, most of it is intramuscular. We
Mhm.
do offer lozenges for people that maybe have needle phobias or whatever, but we just find the potential risk of nauseas more with the lozenges. So we're usually, IM is usually our preferred route of administration. We've also started doing some IV infusions, working with, we have a community care relationship with the Asheville VA, so we're starting to get veterans for ketamine work. So we do IV, IM, a little bit of lozenge work still. We also offer Spravato. We wanted to give people that could not afford access to ketamine to be able to, because insurance will generally cover Spravato if they qualify. This was a way to just try to improve accessibility. And it's not ketamine, it's not racemic ketamine, but it's S-ketamine, which is kind of essentially a molecule off from it. But so those are the services that we provide with ketamine. And yeah, I mean, I think probably the main reason initially all of us used it was because it was the only legal thing we could have access to. And I was not a big fan at the beginning. Everything I'd read was that it was capable of producing these incredible potential improvements in a relatively short amount of time. But the thing I kept reading was, without continued ketamine, that most people reverted right back down to baseline within, 4 to 6 to 8 weeks, something like that. So it just felt like I always thought, oh, this is like a poor man's LSD. This is what we're going to have to use. It's the best we got right now. But
Right. I mean, that's how I got into it too. I was like
yeah.
waiting for MDMA to get approved and thought I'd do ketamine like as like a stopgap and learn as much as I could as quickly as possible and have come to really value and appreciate it for,
Hmm.
for where it fits. So
Yeah.
what do you like about it?
Well, what I've learned is that so much more with this one in particular compared to the other psychedelics. I think preparation, in-session support, and integration are so. I think preparation almost is maybe. I know integration is always supremely important, but I put preparation right there because, the difference I see between ketamine and the other psychedelics is that when I look at MDMA, psilocybin, LSD, ayahuasca, some of those, it feels like those experiences are capable of accessing a deep level and creating, let's just say, more stable, deep structural changes. They're capable of going in there and really tweaking some things deep down. I think ketamine can be capable of accessing those deep things, but I tell people that ketamine is looks at like a catalyst. What it is it's intending to try to go in and maybe unstick you from where you're stuck, whether it's anxiety, depression, whatever it is. But can you get unstuck from your stuck place? And we've got hopefully this blast of glutamate, we've got this antidepressant effect. Can we unstick you from your stuck place? Can you get some insights into the way you're conducting your life in the process? And then most importantly, and this is the deciding factor as to whether ketamine is going to have longer lasting effects or not, is can you figure out a way to integrate what you're getting from these experiences into your daily life? And I find that if people, like maybe they're in the ketamine state and they come out of it and they're like, I got to start eating better, or this relationship really is not healthy for me, or I need to really go back and reconnect with this person. These are little tidbits of wisdom, once again, that are coming from the inner healing intelligence. And so we try to get people to, number one, identify what they are. Can you pull them back from the ketamine space? Can you articulate maybe what the message is here or what the relevance is for your presenting problem or your issue? And then most importantly, can you take this and run with it? Because we do know inevitably without more ketamine, we're going to see that antidepressant effect wane over time. But our philosophy is, in those several weeks, let's say, of this heightened antidepressant effect, can you make meaningful changes in your life so that, yes, when you have that inevitable sort of, evening out, are you living a better life? I mean, have you made some changes so that you're not going to, go back into how you felt? So I think the onus is much more on the person to really take what they get from the ketamine and really put it into their lives and make it work for them. Whereas I think some of these other ones, you still need the integration and all of those things, but I just feel like there's just this ability for this deeper, more stable type of structural changes with the other psychedelics. But is capable of incredible things. I mean, I've become a believer. I mean, I've seen people just
I
I've seen
remember when you were not a believer.
yeah, and
Cracks me up.
because I was like, yeah, it's great. Yeah, we'll use it while we can, but yeah, it's a
I mean, I guess
placeholder
if we
for
have to.
yeah, it's a placeholder for MDMA or
Yeah.
psilocybin. But and honestly, I think a lot of these like pump and dump clinics that are out there that popped up in the last I think they were like, hey, this MDMA thing's coming. We got to get into this psychedelic game. Let's go ahead and do ketamine. We'll have the infrastructure in place, and then when MDMA gets approved and psilocybin, we'll roll right in and make tons of money. And I think that was definitely some of the thinking for folks. But I think, those of us that were really felt called to do psychedelic assisted therapy realize this is the tool that we have that we're given. And, while it may not be the best available, it's incredibly powerful. And if you can learn how to use it right, you can maximize the potential benefits. And it can be a very powerful thing that's capable of long lasting, stable change. To me, it just puts a lot more effort on the person to really want to make this last. And are you really going to make these changes? Are you really going to start getting up in the morning? Are you going to start exercising? Are you going to start shifting some of your spiritual beliefs, things like that. It's like, how much are you going to put this into action is going to dictate, the stability and the kind of results that you see long term.
Good. So I want to ask you another question about maybe the relational components of ketamine and then kind of move into trauma and then what makes a good practitioner. So, just I have a very strong belief, but this is also the way I work as a psychotherapist. I was trained at the doctoral level in kind of an interpersonally oriented psychodynamics. So and that suited me as a human, because I believe that change is all about, difference in relationship to self-world and others. So, and the psychotherapy with ketamine being a profound part of the difference between ketamine treatment and ketamine assisted psychotherapy.
Mm-hmm.
So my sense, I'm working a hypothesis, having only experienced MDMA myself, not having facilitated, and I have the certificate and all the things, but I've not facilitated, psychotherapy with MDMA. So let me own that. You have. So I consider ketamine to be far more relational than most people think. And I think we also maybe have a difference in the kind of dosing strategies that we might adhere to, which is totally fine.
Mm-hmm.
But I consider this being in the person's bubble, as I call it, with them and really being with them on this journey to be an integral piece of the equation. Whereas most people think ketamine is more like inward focus and people can't even interact. And I think it's about preparation and expectation. And, we could get into that too. But I'm curious what you think about that. Can ketamine be a relational intervention? And if so, can that roll into the trauma treatment pieces of it?
I think so. We do our philosophy is we do stay out of the ketamine experience. I mean, we do let people, we don't ask them questions while they're in there. We give them the medicine and then we let them have their experience. We're there to hold hand or do any kind of support they may ask for, but we're really kind of staying out of it, holding space, and being there and just kind of, I tell them we're taking care of everything out here so that you can not worry about it and you can go in and be with whatever's coming up. But I do think the relational piece is hugely hugely important to because you got to make them feel safe because this is all ketamine, just like any psychedelic assisted therapy, is all about their ability to surrender. Can you relax? Can you breathe into and follow the medicine? Don't get ahead of the medicine. Can you follow the medicine? And so I think that relational piece, just from where I'm coming from, is that, it is about making people feel comfortable. We know what we're doing. We got you here. You're safe. It's a round trip ticket. You're going to come back to the chair regardless where you may visit. And, we're going to be here with you the whole time. And yes, I have had those feelings where, where I'm sitting next to the patient and, where I'm kind of, I don't know how to describe it, but just sort of trying to get in there, like just trying to vibe them a little bit of like, you're safe, you can go deeper, relax, and wishing them, healing, things like that. So, I do think that that's a huge piece. And then also coming out of it, being able to have another person that they have a relationship with that can help validate and legitimize whatever, and sometimes crazy stuff happens in the ketamine world. People come out with crazy things. And I'm telling, sometimes it's literal, sometimes it's metaphorical, sometimes it's completely crazy symbolic, but usually it's all information. And with our job is to figure out what is the information there. But I think the relational piece is very important. I think we probably work maybe a little bit differently as far as while they're in the state. Sounds like you might be interacting a little more with them than we do, but
Yeah, not the whole time, but
mhm,
definitely, but it's more of a reflective type of
mhm,
interaction.
mhm.
Let's be curious. Let's just notice, curious where you are in this moment and really
Yes,
tracking based on developmental history, like when to kind of deepen into it. But it is not the same as traditional psychotherapy. We're not really asking any questions other than where are you? And I'm not bringing up any new content that doesn't naturally emerge for them in the session. So it's a
right.
different approach.
Right,
Um,
right. And where I find my clinical training and experience is most valuable is in the preparation
right.
phase because, what we know from experience and training, let's just say we have somebody that's got strong borderline tendencies that we're working with. We know that those tendencies are really rooted in that fear of rejection, fear of abandonment. And so when we are helping them structure intentions, and I tell people these intentions need to be yours and they need to be in your words, but
Mm,
sometimes knowing what the origin is of these issues and how these issues have been maintained over time, the trajectory of them and how they're maintained, that you get from clinical training and experience, that can be enormously helpful, I think, in helping set people up in a way that they are likely to maybe get the most out of their ketamine experience. So that's probably where I'd say I do most of mine is really just kind of trying to trying to help, certainly not dictate, but try to help guide some of their intentions into things that I feel like are really going to help them get at what's underneath
mm.
sometimes.
Yeah, that's nice. I mean, one of the things I'm having just kind of a real interest in is that, kind of assessment piece. And that's a lens that I have. I did assessment for a bunch of years, but that
Mm,
developmental history and,
yeah,
how does this get grounded? I mean, I do 3 to 5 preparation sessions before I even do a ketamine session and really grounding into that developmental history and those relational pieces. And,
that's it.
kind of so that we do have a place to kind of ground the content because the content,
Hmm.
if we're going to believe in the inner healing intelligence, the content's coming up for a reason. Whether
That's
it
right.
might not seem related, it's up here. And if we are holding the history, like I think our job, as therapists is in the integration pieces and in the guidance pieces to help the
Yeah.
client kind of figure out how those pieces go together and then where does that go into their life. So,
Hmm.
yeah.
Yeah. Yeah. Well said. Yeah. I think that's true. I think
Yeah.
that's true. But yeah, the relational piece is important. And there's plenty of studies that show, that having a therapist that you feel safe and feel you have a good relationship with is effective as being on an SSRI. So that
Mhm.
relational piece is just a huge thing, which is why hopefully we'll never be replaced by AI.
Well, so let's talk briefly about trauma.
Hmm.
How do we keep getting better? Like if, we're talking about MDMA for trauma, we're kind of moving into talking about ketamine for trauma. Like you and I are both really invested in the trauma world. So how do we keep getting better? What's the biggest challenge and what makes a good practitioner in psychedelic work, even more specifically for trauma?
Break that down for me.
All
Give me your
right.
first, yeah,
How
tell
do
me your
we
first
keep
question.
getting better at doing this work with trauma? What do you see?
Okay.
Like, yeah, what do we need to do? How do we keep getting better? How do we be the best practitioner we can be to work with trauma in this way?
Yeah. Yeah. Well, my personal feeling is that like I told you earlier, I feel like you trace back everything. The etiology of most people's problems starts with poorly integrated trauma. And then I
Yeah.
think it's the compensations that we develop to try to be able to function. We have this trauma, this primal wounding, and then we have to go out and go to school. We have to go to work. We got to deal with the world. And so we develop these compensations to be able to function, whether it's avoidance or oppositional defiant disorder with kids or whatever. And so I think it's the compensations for trauma that end up dictating our diagnoses. And
Mhm.
so I do feel like the more we can understand that, it's really about, and then we've seen too that trauma, it's not a matter of weakness or strength. It's a physiological reaction. It's something that happens in the brain. And so
Nervous
understanding that, yeah, understanding the nervous system and the brain and that's how it's effective. That's where it's being effective is it's hugely important. So I think continuing to educate people coming through school, young clinicians that come in. I try to tell them, man, you've got to get good at trauma. That's what it's everything is trauma. I mean, even when
system.
you look at some of these conditions that we consider to be more or less purely biological, like, bipolar disorder or schizophrenia, things like that. You look at what is the number one environmental factor that's going to dictate whether a predisposition gets expressed or not. It's usually trauma.
Yeah.
And so I do believe that if anybody that's going to be working with people in this context needs to understand that that's the basis for all the pathology is trauma and the compensations that come from it. So I think educating more and more people about the importance of that is huge. And then I think so much about psychedelic assisted therapy, as you well know, is about set and setting, is about
Mm.
to be able to help that person be in hopefully in a good frame of mind when they go in and do the work, having intentions about this is what I'm interested in exploring or learning about. And then making sure that the setting, the people, the person you're working with feels comfortable with you. It's a very comfortable setting. You don't want these sterile, hospital clinical settings. You want it to feel like a living room or somebody's den where they can really relax. So,
Mm.
I think that's a huge piece of it too. Um, and so I think that we've got these compounds that give us unique abilities to access primal wounding and to be able to make structural changes
Yeah.
that are in this. So that's where I feel like trauma work is headed. I do a lot of EMDR. I was trained in '95 at CIS and EMDR, and I've used a lot of that in the geez, I guess it's been 30 years. And it's my most effective sort of conventional trauma technique. And it is dynamite for single incident trauma. I mean, sometimes one session, out of there.
Wow.
But when you get into these complex developmental PTSD cases where there's just lots of trauma and the threads connect to everything, it's not a great technique. It's like opening up Pandora's box
Oh,
sometimes.
thank you for saying that.
Yeah. And
Yeah.
so I think that's why I think MDMA is so great because, by shutting off that amygdala, by hyperactivating the prefrontal cortex, we're actually creating these ideal conditions for people to go in and actually heal from this stuff. So I really think a big part of your question is just to continue to educate the public, to educate. There's so many professionals in our field that don't understand or they just have real negative concepts about psychedelics because they're still, all they've heard is the crazy shit from the 70s and 80s that still is out there. And so I do think that's probably the best thing we can be doing to help continue to evolve the field of trauma is to be willingly educating people about, hey, here's something you may not know about, or here's something that you've probably heard some bullshit about, and let's look at the science.
I love that. Such a plain sentence.
Yeah.
Awesome.
Well,
I love
well,
that about you, Ray.
well,
Let's just
I
cut to the chase.
yeah, well,
This is
I thought
bullshit. Look at the science.
it is. I mean, I thought Michael Midhover said it directly too. He said that decision in August, purely political. If that
Yeah.
decision had been based on the science, we'd be treating people with MDMA right now. But it
100%.
was a purely political decision. And I think that when the advisory committee meeting met, I think that the FDA was really, they were ready to approve MDMA and they were looking for the political cover to be able to approve it. And of course, symposia, ICER report. And then, I really thought that the whole advisory committee meeting was just a hit job on those folks around the table, with the exception of Walter Dunn. None of them knew anything about psychedelics. They knew
It's
nothing
obvious.
about the history, the research. I mean, it was just, to me, it was just such a fear-based hit job to try to shut it all down. And they did a great job. And so here we are,
There
22
we
veterans
are.
still killing themselves today. We'll lose 22 more.
Yeah,
And we have something that can help them and we can't give it to them.
totally. So if our listeners or trainees, want to work with MDMA, is there any way, like, what do you know? How do people, like, are we all just in a holding pattern? Or, what do you know about ways to get certificate? Like, I know that there are international programs at MAPS, they can be hard to get into, or are we just kind of in a holding pattern? Because people ask me about it all the time, as I'm sure they do you. And, there's the underground ways, but, if people are interested and they want to stay in the above ground legal track. Like, any thoughts?
Well, we are kind of in a holding pattern right now. That kind of started on August 9th, 2024,
Hmm.
when they decided to not approve it because they said they didn't have enough data to make a decision.
Right.
Utter bullshit. But when that happened, it sort of put the brakes on everything, and MAP stopped training therapists. And so that's kind of where we are right now. What I am hearing from people that know a whole lot more than I do is that we are probably 8 months or less away from MDMA being approved.
Hmm.
Um, Lycos has renamed themselves Resilient, and they are going to not have anything to do with the therapy component, and they are going to solely push this pill, midomethamphetamine, to be approved. And so what I'm hearing is that we are 8 months or so maybe from seeing that get approved. So I'm also understanding and hearing that, post approval, it might be like a phase 4 type of a situation, where people, we're still collecting data on efficacy, safety, things like that, but we're not having to do blinding. It'll be more like expanded access where it was still research, but we weren't, we were just collecting data. We were treating people and collecting data. So I think some of the thinking is that we're going to move into that kind of a situation. I think also the prevailing thinking is that you were going to primarily see that in the VAs initially, and possibly like some like universities and research universities,
Hmm.
things like that. And then there's a lot of debate about the therapy that goes along with it. They trashed the whole, non-directive approach, inner healing intelligence at the advisory committee. But again, I think it was just the ignorance of those folks. But they trashed all of that. And, but the reality, like right now in Emory, they're doing, exposure therapy with MDMA, and
Hmm.
it's going to work. I mean,
Hmm.
MDMA is going to create the conditions in the brain to where just about any kind of therapy is going to be way more effective, any
Yeah.
kind of trauma therapy. So I think we're going to see an expansion potentially of models being used, but, I'm hopeful that, wiser heads will prevail and we'll be able to have access to these things. I just don't know how long it's going to take. But
Sure.
yeah,
Yeah.
I'm
Awesome.
cautiously optimistic.
Okay. So you all might hear my cat a little bit. I thought she was in a room. Um, all right. So how do people find you and how do people find the Pearl? What's coming up? Like, how can they find you?
Well, we are located in shimmering downtown Waynesville, North Carolina. And we have a website, pearlpsychedelicinstitute.org. I would recommend people check that out. That's where we have, a lot of what we're up to, blogs. We have our training schedules up there. We do, like you guys, we do a 4-day intro to ketamine training. We're about to roll out an intermediate ketamine training for February or March 2026. So go to the website. We are on social media, let's see, I know Facebook. I don't think we're on X anymore, but we're on Facebook and LinkedIn and some of the. I don't do social media, so I don't know. But my
Well,
daughter does.
you do have social media, and it's actually been quite good lately, by the way.
Good,
Whoever's doing it,
good.
doing a
My daughter
great
does
job.
that. She's
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 doing a
a
great job.
yeah, she's a therapist out in Colorado, and she does
Nice.
that on the side for us.
Awesome.
So yeah,
Good.
nepotism in work. So
Perfect. All right. So
but
you got some
yeah.
upcoming trainings, and people can come to the clinic and actually get treated as a client if they want. And
Yep, yep. If you submit an email to intro at Pearl Psychedelic Institute, that's how to get the referral process started. But if you check out our website, you can see all the services that we do and the trainings. Visit us on social media. We also have a YouTube channel called I think it's the Pearl Institute is the YouTube channel. And there's a wonderful interview with Dave Nichols on there. I would recommend people check out. But yeah, that's the best way to keep up with us.
great. I love that. Excellent. Well, thank you so much, Ray. I appreciate your presence and I appreciate your contributions and I appreciate your absolute steadfast determination to keep pushing that giant rock up the hill. And I'm happy to help continuing to push that rock up the hill. And, stay tuned because it sounds to me from what you're saying and what I hear too, that MDMA is on the horizon. We're just not sure what what form that's going to take.
Right. It sounds like it. Of course, we believed that once before too. So we'll see what happens. But thank you for your work too, because I know, anybody in this racket right now is struggling. It's hard. It's hard to do this work because there is a good bit of resistance out there still to seeing these medicines. So I appreciate all that you guys do too, training people and getting the information out there.
Thank you. I mean, meanwhile, let's just keep doing the best trauma work that we can do and keep it going.
Yep.
All right.
That sounds
Thank you
good.
so much. Appreciate you.
All right. Thank
Bye.
you. Appreciate you.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.